Have you ever experienced an uncomfortable itch that just won't go away? It could be more than just a minor irritation. It might be a vaginal yeast infection. If left untreated, what starts as a small annoyance could lead to bigger health issues. What will you learn in this video? We'll explore who is most at risk for vaginal yeast infections, the symptoms to watch out for, and the most effective treatments. Plus, we'll answer the question, can yeast infections really be passed on through sexual activity? Stick around to find out. Who gets vaginal yeast infections? Vaginal yeast infections are common among women and girls of all ages, with about 75% of women experiencing one at some point in their lives. However, yeast infections are rare before puberty and after menopause. Are some women more at risk? Yes. Certain factors increase the likelihood of developing a yeast infection. These include pregnancy, uncontrolled diabetes, high estrogen birth control, dowsing, recent use of antibiotics or steroids, and having a weakened immune system due to conditions like HIV. Symptoms to watch for. The hallmark of a vaginal yeast infection is intense itching in and around the vagina. Other symptoms include burning, redness, and swelling, pain during urination or sex, soreness, a thick white discharge resembling cottage cheese, typically without an unpleasant odor. You might experience just a few of these symptoms, which can range from mild to severe. What causes yeast infections? Yeast infections occur when there's an overgrowth of candida, a fungus that naturally resides in small amounts in the vagina. This imbalance can happen for various reasons, leading to an infection. Can you get a yeast infection from sex? While yeast infections are not classified as sexually transmitted infections, or STIs, it is possible to get one from your sexual partner. Using condoms and dental dams may reduce the risk of passing or receiving yeast infections through vaginal, oral, or anal sex. When to see a doctor? If you think you have a yeast infection, it's important to consult a healthcare provider to rule out other, more serious conditions like STIs or bacterial vaginosis, also known as BV. These infections require different treatments and, if left untreated, can lead to significant health issues. How is a yeast infection diagnosed? A doctor typically performs a pelvic exam and may take a sample of vaginal discharge to confirm an overgrowth of candida. Treatment options. Yeast infections are usually treated with antifungal medications, which are available over the counter as creams, tablets, ointments, or suppositories. In some cases, your doctor might prescribe a single-dose oral medication like fluconazole. For recurrent infections, longer-term treatment may be necessary. Is over-the-counter medication safe? Yes, but it's essential to consult your doctor before self-treating. Misdiagnosing yourself could lead to improper treatment, which might cause further complications and make actual yeast infections harder to treat in the future. Special considerations during pregnancy. If you're pregnant, vaginal creams or suppositories containing miconazole or clotrimazole are generally considered safe. Oral medications like fluconazole should be avoided as they can cause birth defects. Can you get a yeast infection while breastfeeding? Yes, yeast infections can occur on your nipples or in your breasts during breastfeeding, commonly referred to as thrush. This type of infection, while different from a vaginal yeast infection, is caused by the same fungus and should be treated promptly. Does your partner need treatment? Maybe. While yeast infections aren't STIs, they can be transmitted between partners. If your partner shows symptoms, they should also seek treatment. Prevention tips. To reduce your risk of yeast infections, avoid douching, scented feminine products, and tight clothing. Opt for cotton underwear, change out of wet clothing quickly, and maintain good hygiene practices. Does yogurt help? Some studies suggest that eating yogurt with live cultures or taking probiotic supplements might help prevent yeast infections, but more research is needed. Always consult your doctor before trying alternative treatments. What if infections keep coming back? If you experience 4 or more yeast infections a year, talk to your doctor about long-term antifungal treatment options. research is ongoing into vaccines that could help prevent recurrent yeast infections. Let me introduce you to a product that I find useful. Yeast Infection No More. This comprehensive guide has helped countless women naturally and effectively treat their yeast infections. Unlike conventional treatments that may only provide temporary relief, Yeast Infection No More offers a holistic approach that tackles the root cause of the problem. If you're tired of recurring infections or want to avoid the potential side effects of over-the-counter medications, this guide could be the solution you've been searching for. Packed with valuable information, dietary recommendations, and natural remedies, Yeast Infection No More empowers you to take control of your health and prevent future infections. Ready to experience relief and regain your confidence? Click the link below to learn more about how Yeast Infection No More can make a difference in your life. Please note that this is an affiliate link, and the healthy woman may earn a commission if you make a purchase through this link. This comes at no additional cost to you and helps support the content we create. We hope you found this video helpful and informative. Don't forget to like, comment, and subscribe for more health and wellness tips. Your support helps us bring more valuable content to you. Thank you for watching and take care.